If your quest for longevity feels overwhelming, here's some good news. It starts with one simple daily habit. MitoPure gummies from Timeline. They're the first ever longevity gummies that ignite mitophagy, your body's natural anti-aging pathway. MitoPure is a clinically validated solution backed by over 15 years of research. MitoPure gummies utilize a powerful compound that redefines what's possible for your longevity. MitoPure produces the first ever urolithin A gummies that support your cellular energy so you feel strong, clear, and vibrant. Boost your cellular energy and enhance muscle strength and endurance, all without changing your diet or exercise routine. As someone who loves to stay active, I've noticed a significant boost in my workouts since I started using it. I feel stronger and more energized, and my recovery time has improved dramatically. Better recovery starts at the cellular level. For more information and to order, just go to timeline.com/Hoffman. Use coupon code Hoffman at checkout for 20% off. That's timeline.com/Hoffman for 20% off MitoPure gummies with code Hoffman. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Our subject is autism, and that's an important subject because, according to statistics, we're seeing a shocking increase in the incidence of autism, and various solutions are being proposed. They're working on the high-tech side to determine if there is some kind of potential drug fix for autism. On the other hand, MAHA, in the guise of RFK Jr., is reporting that there may be some environmental causes of autism, and there's actually exploration of a type of vitamin therapy, leucovorin therapy, as a potential fix for autism. We're going to speak to an expert on all things autism related. She's Teresa Lyons, PhD. She's a Yale University trained scientist and a medical strategist, and circumstances have dictated that she become an autism expert because she's an autism parent, and she has lots of insights to share with the parents and grandparents and relatives of autism kids and adults at her website, which is autism.net, but it's spelled AWETISM, which bespeaks a certain autism about the prospects for kids with autism. So without further ado, here's Teresa Lyons. Dr. Lyons, it's a pleasure having you on Intelligent Medicine. Thanks very much for joining us.
Yeah, my pleasure to be here.
So give us a little background on yourself. How was it that you got involved with learning about autism?
I can say that in 2 words. My daughter.
Okay.
So I worked in the pharmaceutical industry. I was a researcher first, and as you mentioned, a medical strategist. So I had experience more on the business side, and I worked in many different therapeutic areas, but never autism.
Okay. So that having a kid with autism kind of propelled you into a search, and you used your scientific background, your research skills, your understanding about neuroanatomy and biochemistry to apply practical and usable solutions for autism. Is that correct?
Yeah, it first started with me wanting to understand what is autism. Because when my daughter got the diagnosis, as a medical strategist, I was prepared and wanting, okay, give me the guidelines. What is the aggressive approach, the non-aggressive approach? What are my options? What are the cutting edge? What are the clinical trials? So I really wanted a full playbook. And when I asked for, okay, what do we do now? The reply is, well, there's not really much you can do. It typically gets worse, not better. There's, a few drugs, but that's really just to decrease irritability. It doesn't really have that much of an impact overall. And there's some, side effects to that. And there's some behavioral therapy. And all of that was just very empty. As a strategist, I thought, this can't be it.
Right.
These are not good options whatsoever.
And so basically, if you talk to a pediatrician or a developmental expert, they'll say stand by because, we're doing research is apace, and maybe in 5 or 10 years we will have cracked the code. But this could have a crucial developmental window for kids, and delay means the likelihood that symptoms will be locked in or persist, right?
Right. And for me, I knew that, okay, it takes 20 to 30 years for a discovery to really make its way down into mainstream practice. And I did not want to wait 30 years for my daughter, right? I mean, she'd be close to middle age by the time something could be done. So what I did was I went into PubMed, into the scientific literature, and really got to understand what are people doing, what are the clinical trials, what is autism, so that I can at least start to make some inroads into something.
So there's a certain fatalism, as you've already stated, about autism that, once diagnosed, that you can mitigate or ameliorate the symptoms. And yet you cite a 2023 study that suggests that there is some degree of likelihood that children can actually, quote, lose their autism diagnosis. So what does that mean? And to what extent is that possible?
So that research shows that it was done at Boston Children's Hospital, so a very reputable hospital. And it showed that over several years, a certain amount of children in that study, it was 37%, they actually lost their autism diagnosis. So autism is diagnosed based on observation, right? So that means there's an issue with speech, whether there is no speech or restricted speech. There's some type of repetitive behavior, and there's a difficulty with social illness. And all of that is done based on observation. And what has been known in the literature, not just that study, is that children don't always retain their autism diagnosis. Their parents do certain things. Sometimes people think, oh, they just grew out of their autism. Mm-hmm. No, that's definitely not it. But an autism diagnosis is not lifelong for everybody.
And so when we say grow out, does that mean that kids can somewhat improve? Or does that mean that there can be virtually a complete mainstreaming of kids, that they can, go to regular, high schools, college and university, assume professional jobs, raise families, and have virtually normal social interactions? Can we expect that degree of improvement for children labeled autistic?
For some, yes. For some. Certainly. So an autism diagnosis is not lifelong, meaning the children are able to participate in school the way they want. They don't need additional supports. They don't need additional therapies. The autism diagnosis is based upon observation. So that child, if observed again, would not receive that autism diagnosis. They would be indistinguishable to a child that never had an autism diagnosis.
Well, that's an exciting prospect. So, there's a big debate about the incidence of autism. Some people say, well, it's soaring. There's something happening here. What it is ain't exactly clear. It's clearly environmental. I think that's sort of the Maha viewpoint, is that children's health is being undermined by a concatenation of environmental and dietary factors. And then there's the view that maybe autism is now more frequently diagnosed because we're more attuned to the diagnosis. Also, we incentivize the diagnosis because schools receive more money for special education, and there's more money available to special programs for autistic kids, and hence maybe that incentivizes taking kids who are a little borderline. Maybe they're on the spectrum, but then they're given a full-blown autism diagnosis. So what say you? Is there really something going on there that's propelling these statistics?
There's definitely something, although I don't think you can universally apply it for everyone who receives an autism diagnosis. And that's what makes autism so complex, is that it doesn't impact the person exactly the same way as everyone. And it also, the root causes and different health issues that people with autism struggle with are not universally the same. So that's where it starts to get complex. And unfortunately, what people try to do is they try to find the one thing that
Yeah.
can explain all of autism.
Right.
And if you try and do that, you end up explaining nothing,
Right.
which is basically
is
what's
it Tylenol
happening.
during pregnancy? With a lot of great fanfare, they announced a press conference to the big reveal, the cause of autism. And then, they talked about Tylenol in pregnancy, and then they talked a little bit about the use of leucovorin. And it was a little bit of a oversimplification.
Definitely an oversimplification for sure, but those are certain important aspects for parents to think about. And I really see that conference as a way of getting people to talk about, how do we think about autism? How do we define it? How do we actually make an impact of it? Because it's in the scientific literature. So when my daughter was diagnosed with autism, it was 10% of kids with autism lost their diagnosis, meaning they had, some people call it a full recovery. Some people call it a cure. What it means is that a child's able to go on in life without any of those particular barriers that an autism diagnosis brings. So it's definitely important that people are discussing this, but it would be very difficult for one single thing to really explain all of autism.
So one might say that just as there are dementias, many different kinds, maybe due to different factors. One person's dementia may be caused by a completely different set of circumstances than another's. That there are autisms. There are different precipitants of what seem to be behaviors that are kind of lumped together. It's kind of a wastebasket diagnosis for a variety of social and intellectual deficits.
Correct. So there are different levels in autism. And so that is something that initially an Asperger's diagnosis was a separate diagnosis than autism.
Kind of like the Rain Man movie, Dustin Hoffman, that whole thing.
Right. So an Asperger's typically has been thought of as being more high functioning. Mm-hmm. And high functioning in the sense that that person might be able to dress themselves, might be able to cook breakfast, as they get older, walk across the street, drive a car. And that's what an Asperger's diagnosis used to be. That's now been rolled into an autism diagnosis. So there is this broadening in the sense of we don't have those separate diagnoses for different levels of functioning. It's all autism now as a diagnosis.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message to you. So here goes. Listen up.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
Thanks for listening. Thanks for supporting our sponsors. They are what make intelligent medicine a continuing free resource to you. And now back to our discussion about autism with Dr. Teresa Lyons. One of the big therapies, right now, there's not a lot to be offered to kids, but they're told that very early on, they have to get into this thing called ABA. And I'm not sure what that acronym stands for, but it's all about ABA. And in fact, just personal anecdote, I used to work in a building where I occupied one floor. My center was on one floor of the building. And gradually, after many years, an autism center moved in, ABA. Mm-hmm. And it was initially on one floor, and eventually they began to occupy the entire building. There was such a surge in demand for ABA that just became the path to improvement and salvation. And it may play a major role in helping kids, surmount their challenges. But what are the limitations to that? What are the advantages? What are the limitations to ABA? What is it?
Sure. So that's a huge topic. So ABA is applied behavioral analysis. And so what that looks like is, let's say you're trying to teach a child colors, right? So red and blue. And the therapist might put, a red block and a blue block and say, all right, give me the red one. And let's say the child does not move. Then the therapist will take their hand under the child's hand and show them basically, okay, with gross motor skill, pick up the block. That one is red. Give it to me. They have to do that many times. So usually to show mastery of a skill, they have to do it 10 times with an 80% success rate. And this is the gold standard for autism therapy. It's basically the only thing covered by insurance.
Right.
So that's why we hear about it a lot. And that's why it's also very popular, right? Because if insurance pays for it, then many times we think, okay, that's good. Now, that might not be the right thinking, but that's the reason why you see such an increase in popularity. And now also, what has been shown is that you need 40 hours of ABA therapy a week for the child in order to make progress. So they break everything down into small steps.
That's like a 9 to 5 job for a child that, maybe, barely a toddler.
Correct. Yeah. Like a 4-year-old, they're saying that you need 40 hours to sit at a desk, right? So it's really sitting at a desk and doing this interaction one-on-one with a therapist. Now, when the child gets 10 of those right, or, there's time for a reward, because many times these kids are working for rewards. These are extrinsic rewards. So it might be something like, okay, you can have a cookie, right? So you've pointed out different colors and you've done that repetitively. You can have a cookie. Now, sometimes kids don't want a cookie. Maybe it's after lunch. They're not hungry, right? So the therapist is always thinking, what extrinsically can I dangle in front of this child for them to do what I want them to do?
Right.
So there's a lot of controversy as to how are we teaching our kids, right?
Yeah.
Because this is where the iPad is used a lot for reinforcers. You do work for 15 minutes and then you can have a 5-minute break on your iPad. And so it certainly has an impact on how that child with autism views the world.
Yeah.
And many older people with autism who have been through things like this really have difficulty and say that this is not an appropriate way to teach a child because of the intensity, and also the reward system is it's not self-rewarding.
It's almost like obedience school training, for your pet.
Yes. So there's parents. It becomes so difficult as a parent because you hear this thing where, okay, ABA is really it's the only thing that works, so supposedly, and I should do it for 40 hours. And then you go there, and a lot of times parents are like, I don't really want to do that for my child, right? Because you see it. You see the repetitiveness. You see, M&Ms or cookies being used as reinforcers.
I kind of watch them doing that with the seals in Central Park. They do a little thing, and then they throw them a fish.
And they get a little treat.
Right, yeah.
Yeah. So for some parents, they just think, oh, I can't do that to my child. And some kids respond really well to it for learning certain things. But then when you try to apply it to socialization, right, you get these flashcards of, okay, now I have to memorize the way someone looks. And now you're trying to interact with the world based upon memorization. So then this also creates anxiety because kids who go through a lot of ABA sometimes don't have that dynamicness for life. So when something changes or it's a little different, it gets very panicky because, wait, I don't know how to
They don't train them to social
situation.
cues. They don't, it's more almost like a rote, performative kind of thing, right?
Correct.
Yeah.
So that's the old aspect. So that's ABA. That was what was recommended when my daughter was diagnosed. That's what they meant by, there's some behavioral aspect, but it's not very satisfying. So educational approaches evolve just like medicine, right? So just to touch upon what has evolved, although it's not very popular yet, again, it takes 20 to 30 years for things to come into mainstream. So there's something called RDI, Relationship Development Intervention, and also PRT, Pivotal Response. And so these two therapies are tapping into the child's intrinsic motivation, right? Which is glorious, right?
Yes.
That's what we all want our children to, want to learn because they're motivated to learn or they're motivated to interact with someone. So an example of that would be if a child likes to, go out and be on the swing, right? And you're trying to get them to give you eye contact or, really have more of that socialness. The child can go on the swing and you pull up the swing and you just hold it. And then they look at you. And then that's when you give the intrinsic reward of, oh, you looked at me, you want to play? Here, let's play. And you let the swing go. So ABA is definitely a technique that can be used for certain aspects. Anything where the repetition is how you would learn. But when you're teaching socialization or really having that dynamicness in life, you would want to look at other approaches. But they're typically not covered by insurance, which is frustrating.
Well, so what distinguishes those approaches is that they don't really look to the biological underpinnings of autism, which I think is an area of controversial research. Are there connections to nutrition? Are there connections to the microbiome? Are there connections to environmental exposures? And I think that that's something that is part of your remit at Autism, spelled AWE, tism.net, where you explore some of these areas. And you explore it, I think, with a critical eye because you're a scrupulous scientist with a PhD background. You don't want to sell people a bill of goods, but you also want to look at things objectively.
Definitely. So when I was going through this with my own daughter, I needed the information. So I needed quality information. I didn't need secondhand information or, dramatized information. I needed quality information. And then I needed to have a lens as to, does that apply to my daughter? So there's so much that goes on with autism, right? So, there are different risk factors. So something like an autoimmune. So if a family has a history of autoimmune diseases like lupus, that can increase autism risk by up to about 30%. So there are these different things that parents need to think about, right? So you mentioned the environment. Air pollution, it can increase autism risk, again, by 20, 30%, sometimes even 60%, depending upon the time of the exposure. So these are all the things that parents need to know. And this is why it's so hard to ever just come up with one reason to explain all of autism. Parents really have to have that lens of, does this apply for my child?
Indeed. So does that lead us to conclude that maybe there are some low-risk interventions, either nutritionally, dietary, that are salutary? Because, you point out on your website, there is no such thing as an autism diet. But you do point out that there's the potential for diet to help, but it needs to be personalized nutrition and tailored to the individual circumstances of the child. How does that work?
Correct. So there are 8 diets that are commonly used by autism. 8. Yes. Oh. Yes. And there's, over 50 different symptoms. If you line up all those diets and look at all the different symptoms that they can address. So it's important to really involve health. So you asked about what are some basic things to do, right? So you want to look at basic
What are
health.
the common denominators? There may be some commonalities that apply to all the diets.
Well, looking at all of the diets, mainly they do focus on reducing inflammation. So that would be, that high level. What do these diets really do? They reduce the inflammation, but they do that in a variety of different ways with different ratios of fats or carbs. And kids respond to the different diets differently because it depends on the microbiome. So sometimes there are gut infections that really respond well to diet changes and then maybe prescription or supplement antifungals, antibacterials. to resolve those gut infections. So it's the thing with autism is you can't just do one thing and then expect it to resolve tons, right? So a lot of times it's additive. You got to change diet. Okay. And then let's look at something basic like vitamin D. Let's look at nutrition. Are they getting enough B vitamins naturally from what they're eating? Are they getting enough calcium? So there's so much to really look at. I mean, hydration is another thing. Many kids aren't even just adequately hydrated with the electrolytes, right? So potassium and magnesium, do they have enough? So there's so much to basic health that parents can look at that is not controversial. It's not extreme. It doesn't run a risk of harm because you certainly can do very basic blood work that's covered by insurance, right? So there's so much that parents can do in that area of, let me make sure my child has optimal health from just a basic standpoint.
And you talk about the role that functional medicine might play, and that's a bit of a buzzword. We've had experts on functional medicine. In fact, we've had a guy who's widely considered the godfather of functional medicine, Dr. Jeffrey Bland, on this program as a guest, and he's a frequent contributor here on Intelligent Medicine. But how does functional medicine apply to the problem of autism? What is it?
So functional medicine is asking the question, why? Why is that happening?
Root cause.
So to give you a perspective, we can look at constipation. So constipation happens commonly in kids with autism. And so if you go to a functional medicine doctor, they're going to try and understand what's causing that constipation. Whereas if you go to, let's say, just your general pediatrician might say, all right, well, constipation occurs commonly with autism. You can't really do anything about it. It's, here's some Miralax or some type of laxative, right? So that solves the problem for the short term, right? So, and sometimes that is what is needed, right? So you relieve the constipation. However, if you stop that Miralax, the problem comes back, right? So you didn't really get to the why. It's a very short-term solution. With a functional medicine, they'll ask the question, okay, why is there constipation? So is there a deficiency in magnesium, right? So a lot of times that is what is seen when there is deficiency, a whole variety of other things that can happen too. But magnesium a lot of times is really looked at. Then they look at diet. What's the fiber? Then they'll look at gut motility. So how is the actual functioning of the gut and moving things, right? And now you're starting to get into motor control. Then you're starting to get into things like, all right, is the environment, is there some toxin that is causing an issue? Is there inflammation in the gut, right? So you can start resolving these things so that when you stop whatever that short-term solution was, the problem is not there anymore. And that's really the difference. So it's not as if functional medicine necessarily is always better than conventional medicine, but as an autism parent, you want to use both.
Okay. Well, good. You've laid down the groundwork for a discussion in part two. I want to focus in on, specific interventions, supplements that, according to your research and also your wide network, because you communicate with, hundreds and hundreds of parents who share their experiences with you. What works, what doesn't work so well, what are some of the pitfalls, what are some of the promising avenues for ameliorating the symptoms of autism, and even hoping to, and this is a big reach, it's a heavy lift, to mainstream kids with autism, because indeed studies suggest that that prospect is real in certain cases. So we'll talk about that in part two. Our guest, Teresa Lyons, who is a Yale University trained scientist and a medical strategist. That's what she positions herself as the developer of Autism.net, AWETISM. Also author of The Lyons Report, LYONS, The Lyons Report 2020, Autism and Functional Medicine, Doctors, a resource for parents and relatives of autistic kids. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. We'll be back with more on the subject of autism.